Good afternoon. Welcome to the reconvening of the Assembly Committee on Health and Human Services today, Monday, March 24th. Secretary, will you please recall roll just to make sure that all are present and accounted for?
Assembly members Dahlia, Edgeworth, Gonzalez, Goulding, Gray, Hafen, Hibbets, Hunt, Jackson, Koenig, Nadeem, Nguyen, Orntlicker, and Chair Brown May.
Thank you. I am here. Please mark our other two members present when they arrive. Members, we have a number of items on our agenda today. First, we're going to go into work session. We have 3 bills on work session today. We will start with bill number, Assembly Bill 6, which establishes the Fetal Alcohol Spectrum Disorder Treatment Assistance Program within the Aging and Disability Services Division, and I will turn this over to our policy analyst.
Thank you, Madam Chair. Davis Florence, Committee Policy Analyst for the record. Assembly Bill 6, which was sponsored by the committee on behalf of the Aging and Disability Services Division of the Department of Health and Human Services and was heard on February 10th. AB 6 creates the Fetal Alcohol Spectrum Disorder Treatment Assistance Program within the Aging and Disability Services Division. The program, which is administered by the Autism Treatment Program, aims to provide and coordinate the provision of services for individuals diagnosed with fetal alcohol spectrum disorders through the age of 13 years. And there are no amendments for this measure. Thank you, Chair.
Thank you, Mr. Florence. Members, are there any questions on this measure? Seeing none, I'll entertain a motion on Assembly Bill 6.
Motion to do pass.
Motion.
86.
A motion to do pass by Assembly Member Vice Chair Nguyen, second by Assembly Member Hunt. Any discussion on the motion? All those in favor say aye.
Aye.
Any opposed, nay. Hearing none, motion passes unanimously. Thank you. We'll assign that floor statement to Assembly Member Hunt. Thank you. Next up is Assembly Bill 36, which revises provisions relating to Medicaid. Mr. Florence.
Thank you, Chair. Davis Florence, Committee Policy Analyst. Assembly Bill 36, which was sponsored by the committee on behalf of the Division of Healthcare Financing and Policy, was heard on February 12th. AB 36 requires a service provider under the state plan for Medicaid to request a hearing within 90 calendar days after the date of the notice of action taken against them by the division. Unless extenuating circumstances exist, this bill requires the division to adopt regulations that outline the actions for which a service provider may request a hearing and the circumstances that constitute extenuating circumstances. And there are no amendments for this bill. Thank you, Chair.
Thank you, Mr. Florence. Members, are there any questions on this measure? Seeing none, I will entertain a motion to do pass Assembly Bill 36.
Move to do pass. AB 36.
A motion by Vice Chair Nguyen, second by Assembly Member Gonzalez. Thank you. Any discussion on the motion? Seeing none, all those in favor say aye.
Aye.
Any opposed, nay. Hearing none, motion passes unanimously. Thank you. Floor statement to Assembly Member Gonzalez. Thank you. Next on our agenda is Assembly Bill 42, which revises provisions governing the adoption of regulations for the administration of certain programs of public assistance. Mr. Florence.
Thank you, Chair. Davis Florence, Committee Policy Analyst for the record. Assembly Bill 42, which was sponsored by the committee on behalf of the Division of Healthcare Financing and Policy, was heard on February 12th. AB 42 authorizes the administrator of the division to adopt, amend, or repeal a regulation or policy with 3 business days' notice if the action is required in compliance with federal or state law, or secondly, results in expansion of service or benefits. And there are no amendments to this bill. Thank you, Chair.
Thank you. Members, are there any questions on Assembly Bill 42? Seeing no questions, I will entertain a motion to do pass Assembly Bill 42.
So moved.
Motion by Vice Chair Nguyen, second by Assembly Member Gonzalez. Any discussion on the motion? Hearing none, all those in favor say aye.
Aye.
Any opposed, nay. Hearing none, motion carries unanimously. We'll give that floor statement to Assembly Member Edgeworth. Thank you. That wraps up our work session for today. Thank you, members. And we will now move into our first bill hearing of the day, Assembly Bill 339, which creates the Office of Children's Mental and Behavioral Health within the Office of the Director of the Department of Health and Human Services. We will welcome our Assembly member to the table alongside her team, and you are welcome to begin when you are ready.
Thank you, Chair Brown May and members of the Assembly Health and Human Services Committee. I'm Heather Goulding. I represent Assembly District 27 in Washoe County. We are here today to present Assembly Bill 339 that will, if passed, create the Office of Children's Mental and Behavioral Health. This bill is the outgrowth of a recommendation made by the interim HHS committee, as were the 3 bills that you just passed out of this committee right now. In the United States, nearly 50% of children have a mental health disorder, and nearly 60% of those children do not receive any treatment. Nevada's existing system on care for youth with mental and behavioral health issues overutilizes hospitalization and out-of-state residential treatment facilities that don't provide adequate support and separate children from their families. Nevada needs centralized leadership to address this crisis and bring more community-based options to our state. AB 339 will provide that leadership. Here with me today to present AB 339 is Dr. Tara Rains and Carissa Pierce, both of Children's Advocacy Alliance. Chair, with your permission, I will hand presentation over to Dr. Rains.
Thank you. Welcome, Dr. Rains.
Thank you. Good afternoon, Chair Brown May and members of the committee. I want to start by talking a little bit about the origins. My name is Tara Rains, for the record, Tararaines. I want to start by talking a little bit about the origins of this bill. At Children's Advocacy Alliance, we partnered with City Councilman Brian Knudsen and launched the Children's Mental Health Action Coalition. And out of that coalition, we did a needs assessment of community members, providers, trainers, parents, youth, and we asked them what are the greatest needs in Nevada in regards to children's mental health. And overwhelmingly, leadership came up as a need. From the consortia, we took this idea to the Interim Health and Human Services Committee, and that is where this bill came from. So this is the problem. If you look at this graphic, you can see our current model for children's mental health services here in Nevada. It is difficult to determine who has authority. It is difficult to determine what recommendations go where. We have a number of groups that do incredible work. We have our Children's Mental Health Consortia across the state. We have regional behavioral health policy boards for different regions of the state. We have our school districts, our 17 school districts. And so what we're looking for is a more streamlined approach to children's mental health decision-making across the state. So why? A few reasons. First, the state of Nevada was sued by the Department of Justice, and we're very fortunate to have great leadership, and they were able to settle that. And what they found in this suit was that Nevada does not provide services to youth with children's mental health disorders in their least restrictive setting, which means we are not offering community-based services that students should get. In fact, we're sending lots of youth out of state to get mental health supports because we don't have the infrastructure here in state to provide them. Again, those lack of community-based services, taking students or youth to more restrictive environments. And then also, we don't have the leadership. There was no systemic organizational leadership available. Also, we know that we need leadership in regards to mental health screening and assessment. We need someone leading our efforts for wraparound facilitation, as well as someone who can hear the voice of children and families and various stakeholders to make sure that those voices are incorporated in the mental health strategy for the state. Finally, the biggest thing we need, other two big things we need are data collection, right? It's hard for us to understand the true mental health need in our state because we are missing a lot of data because of our lack of practitioners and our limited workforce. And then also quality services review, right? There's no mechanism, no clear mechanism for providers who are receiving state funds to demonstrate that they're engaging in evidence-based practices, nor to determine whether or not those evidence-based practices are leading to the outcomes that we want to see. Other reasons, again, implementing and evaluating strategic plans. So our boards and consortia across the state put together incredible strategic plans. They give us great information on what their individual communities need, and it's difficult to see who is accountable for implementing those strategic plans from these boards and consortia. Also, we want to make sure that there's, again, that standard of practice for folks who are receiving public funding, making sure we're getting those evidence-based practices, and also like a cohesive strategy statewide to really move the needle on what should be done in regards to children's mental and behavioral health, and then also someone who's able to kind of coordinate and talk to the different departments as a single point of contact. So our solution is much cleaner than the original proposed problem. What we are proposing is an Office of Children's Mental and Behavioral Health that will live in Health and Human Services. So how is this different than what we've done before? We've worked with stakeholders who told us we've tried to do this and it didn't work, and we've asked for feedback as to why it didn't work, and largely it has to do with accountability and authority. So we know that this Office of Children's Mental and Behavioral Health will be accountable to HHS. We've talked with stakeholders about what it would mean for this to live either in the governor's office of mental health or the Nevada Health Authority, depending on how those legislative pieces work out. And then also, this would be a single point of contact to hold the boards and consortia accountable. Budget also came up as being a barrier to folks who've tried to do roles similar to this in the past, meaning that this particular office would need access to federal block grants and other monies that come to the state specifically for mental health support. And then also integrating some of those responsibilities. And so making sure we have someone who can bridge the gap with our statutory mandates, also implement a Centers for Excellence model, and really just steer the ship so that we know what direction we're going in regards to children's mental health. So a few thoughts, and we are working with stakeholders who have potential amendments and opinions on who should be leading this office. At a minimum, we know that this person should be licensed to provide children's mental health services in Nevada. We know that they should have some leadership and administrative experience and at least 5 years of clinical experience. We want this person to be impartial between both consumers and providers, and then also have no conflicts of interest. As we ask to round out the office, we want to make sure that the Office of Children's Mental and Behavioral Health has the tools and the staff that would be needed to be most successful. That includes a data analyst to help us better understand our landscape from a data perspective here in the state, administrative assistant, community engagement outreach professional. And we feel this is important so that the voices of children and the voices of families can remain centered in the strategic planning and the work done by this office. Research and grants professional, of course, to help draw down federal and private dollars that would support the children's mental health mission in our state. And then also clinical implementation and quality assurance professional. Again, we know that there are folks doing practices in the state that are less than best practice or maybe not evidence-based practice, and we want to steer away from that and make sure that there are people out there to be certain that there is accountability and that practitioners are engaging in best practices. And that is what we have for our presentation. Thank you.
Heather Goulding. For the record, I will walk you through the bill, and I handed out copies of the amendment. Hard copy, I wasn't sure if they had made it up onto Nels. Section 1 requires the Commission on Behavioral Health to work with the new office and integrate its statewide mental health plan for children into Commission policies. Section 2 directs regional behavioral health policy boards to coordinate with the new office when making recommendations about children's mental health needs. Section 5 formally creates the office within the Department of Health and Human Services. It also directs the department to appoint the director to the office who will oversee its operations. And the amendment to Section 5 adds qualifications for the director's position. Section 6 assigns the office key responsibilities, including developing a statewide plan for children's mental and behavioral health services, reviewing mental health consortium strategy plans and budget requests, acting as a central resource for children's mental health information. The amendment adds the requirement that the office submit a report for establishing a Children's Behavioral Health Center of Excellence. The amendment also adds staffing requirements to make sure that the office has the resources it needs to be effective and successful. Section 7 allows the office to apply for grants and accept donations. It also requires state and local agencies to cooperate with the office as needed. The amendment in Section 7 allows the office to apply for available grants and access funds from federal block grants such as mental health and systems of care block grants. Sections 9 and 10 update existing law to require mental health consortia to submit their reports to the new office and collaborate to avoid duplicating services. Section 13 eliminates the subcommittee on children's mental health, transferring its duties to the new office. This bill will streamline children's mental health services in Nevada by consolidating oversight under a single office, improving coordination, and ensuring sustainable funding. Chair, we are ready for any questions from the committee.
Thank you for your presentation. Thank you. I know that we do have a couple of questions. Vice Chair Nguyen.
Thank you, Madam Chair. Thank you all for the presentation. I think I would definitely want to ask a couple, if I may, Chair. I'll just go with my first one. The 5 years clinical experience, Dr. Rains, do you think that is going to kind of narrow the pool of folks that we would want to recruit for this role?
Thank you, Tara Rains, for the record. I believe that a minimum of 5 years clinical experience is necessary so that the leadership has had exposure to a breadth of clinical presentations and had time to get to know a little bit more about their own strengths in practice and what types of practice are available.
May I have follow-up, Chair? And then the part of the report, it looks like it seems to be, the language seems to only address a one-time report. Is that the intention, or we're trying to establish an annual report?
Terrence, for the record, thank you for your question. Would you be comfortable with us calling a lifeline? We've got some folks here from Medicaid, and that was their...
That would be great.
Thanks.
Chair, Committee, Ann Jensen for the record. I'm the Innovation Officer here at Nevada Medicaid, and I'm working closely with our settlement agreement with the Children's Behavioral Health Transformation. The Center of Excellence is a crucial piece of our ability to meet the settlement agreement terms. The report for our state's ability to develop one would be a one-time report because we need to determine the path forward to create it. However, I do see this office, if created, playing a role throughout the course of that development process, which we expect to take a few years. Let me know if that helps to answer your question.
So yeah, I just want to make sure that if we can look at the language to ensure that there's additional reporting language in here, just so that we know that it's an ongoing work and not necessarily just a one time, to make sure that we track this, because I think this is great what we have, but I just want to see a little bit stronger language.
Absolutely. Thank you for your feedback.
Thank you, Chair.
Thank you. Members, any other questions? Thank you. I do have a question. Thank you for coming to the table. I want to thank Dr. Rains and your team for the amount of work that you've done, knowing that this was originally discussed in the interim. This is a committee bill that has come to us, so I know that we've spent a fair bit of time focused on addressing the needs of our youth who have mental and behavioral health needs. I'm curious to know, do we have someone in the room that can talk to us about what the state is currently doing to serve children's mental and behavioral health? I know that we have a couple of our administrators here. I want to make sure I don't put anybody on the spot. So, I mean, we did not discuss previously, but if you're comfortable, I'd love to get on the record what we're doing currently.
Good afternoon, Cody Finney. For the record, I serve as the Division Administrator for Public and Behavioral Health, and we currently oversee the Mental Health Services Block Grant, which was mentioned, and part of that goes to Children's Mental Health Services. That is particularly, we also work very closely with Division of Children and Family Services on making sure that those dollars are particularly well spent, and we provide services with those that Medicaid cannot otherwise fund. And also that block grant is heavily invested in developing community services. It is a limited amount of money as a block grant, but we use that to develop community services that can then hopefully spin off and become reimbursable in other mechanisms in other ways. And that is a great foundation in some places. Thank you very much.
Stacy Weeks for the record, Nevada Medicaid. As my colleague Ann Jensen just mentioned, we are working on the DOJ settlement agreement. I just want to say that we currently coordinate a lot with DBPH as well as DCFS and the counties on these issues. I think with the DOJ settlement agreement, it's given us something to sort of coalesce around. And a big focus of that, and which Cody has already, Administrator Finney has already mentioned, is working on community services. Is what we really need in the state, is to really build out that infrastructure. And so we are currently investing and working to get benefits up online, working closely with DBPH on their mobile crisis, statewide efforts around that. We're also working on a variety of rate increases at Medicaid to try to build our behavioral health care system statewide for children.
Thank you. Thank you all for being here. I sincerely appreciate that. Don't go anywhere, please. Just a minute. Thank you so much. This is just such a great opportunity to really talk about what we are doing as we're focusing on youth in Nevada currently. And as a part of being the solution, really is, I think, our focus here and why this measure was brought forward from the interim. The goal of the state, as my understanding, is not to be the service provider, but to instead to work with provider organizations to be able to find solutions for the youth that we have in our community. We do know about the Department of Justice, right, and their review and assessment. Since that time, have we made progress toward having a single entity or a single point of contact where a family can go to get services or to get referred out? Is there like a single place, a single website where if you're in, you need services, where do you go? Like, how do we navigate that? And I think that's what this Office of Children's Mental and Behavioral Health is designed to do, right? To give a family a place to go to get referred out to service. Do we have that currently?
Cody Finney for the record. I don't know if we have exactly that currently. We do have a couple of resources that I can think of currently that provide some of that. One is the Pediatric Access Line that we're funding. One is the 988 Crisis Line that provides services to folks who are, or information and referrals to folks who are having crisis. And some of those services are provided by the state. Those mobile children's crisis services, in some cases, are provided by the state. But we do have a couple of those places. Certainly would not disagree that additional coordination is helpful.
Thank you for that. Do you know, when I call a 988 helpline and I say I'm 15 years old and I'm in crisis, do I then get specialized services for someone who is not an adult? Do you know?
Cody Finney for the record. There are some specialized services available for non-adults. I can't answer the question about exactly what happens when when someone calls the 988 line off the top of my head, but I'd be happy to get some more details for the committee on that.
Thank you. I appreciate that. And then first, I just want to say how grateful I am that you all three are here, right? Really working to find solutions for the youth in our state and our families that are just obviously in need of assistance. Do you have an opinion relative to the infrastructure that would be necessary in order to ensure youth in our state have access to the services that they need? Any advice? And how about this? I don't want to set you up, and I apologize for that. That was so open-ended. How about this? I don't have a poker face either. So, is there a strategic plan that has been developed within your department or division to help us meet the needs of our constituents that are youth with mental health needs?
Chair, committee member Stacy Weeks for the record. We are currently working on that now for the DOJ settlement agreement, and we'll have that hopefully in the next 90 days because we have to have that to them at that time.
Thank you for that clarification. Thank you for the answer. Members, are there any other questions here? Okay, thank you so much for being here. Thank you. Okay, at this time, we'll move into support on Assembly Bill 339. If you are here in support of this measure, I will just remind you all 2 minutes. State and spell your name for the record. Anyone here in support in Carson City? Seeing no one. Anyone in Las Vegas? Thank you. Please state and spell your name for the record. You may begin when you are ready.
Good afternoon, Madam Chair. Brian Knudsen, Brian Knudsen. I'm coming to you today as a parent first and foremost, but also I have some wonderful experiences working with a lot of the youth in Southern Nevada. My first off experience, I just want to make sure you know I obviously serve as an elected official with the City Council of Las Vegas, and I regularly meet with school principals. Behavioral issues is one of the biggest challenges facing our schools right now. It's leading to a lot of the teachers who are leaving early and is creating a lot of the challenges that we're seeing in our youth in our community right now. I also have the privilege of working with a lot of the mental health providers in town and was able to visit our juvenile detention facility with the #1 challenge that those kids are experiencing as fetal alcohol syndrome and ADHD. And this is where it gets a little bit tough for me to deal with because lo and behold, a couple of years ago, my son started to demonstrate some significant challenges and issues. When a referral is made, it took quite a while to get a referral and a name of someone who could see my son. And I apologize, I get a little bit emotional. But the waiting list to get a diagnosis is 2 years. That's, for me, again, an elected official, it's a 2-year waiting list. My daughter is also experiencing some of those same issues right now. It's a 2-year waiting list unless you know somebody, and there's really only a handful of people in our community that can do this. When I finally got a diagnosis and a referral, the practitioners, the speech pathologists, the physical therapists, those are 6 to 9 month waiting lists to get into anybody. All of them who take insurance, if your insurance will pay for them, it's great. I got so frustrated that I decided to pull together a coalition of mental health providers who work solely with children. It was very consistent, their messaging back to me. One was, there's no real training ground for youth professionals in this field in Nevada. 2, there's no bringing them together. There's no coalition that has worked in the past. They make referrals via Facebook. But what I think is most important for this committee to understand is that the majority of those mental health professionals only take cash. And they did that because they were struggling on working with Medicaid and private insurance companies. So now, 2.5 years later, I'm fortunately able to provide my son services because I can afford to do it. I'm going to start working through the waiting period of trying to get my daughter into services. But again, this is for me, an elected official with access and privilege. I can't imagine what it would be like to be a youth in our community or a parent of a youth trying to find services and waiting 2 years to get a diagnosis. I think from a state perspective, we have to get ahead of the game to keep those kids from leaving schools, to keep those kids from entering into child protective services, juvenile protective services and detention facilities. And I think overall, this is going to be a huge cost savings if we understand how do we get to services to children earlier. Madam Chair, I appreciate the opportunity to speak, and I appreciate this committee's time.
Thank you.
Hello, my name is Ashley Pruitt, ASHLEY PRUITT, and I am a private citizen of District 2. I'm very happy to see this bill presented today, and I'll tell you why. 11 years ago, I was a wraparound psychiatric caseworker, and I worked within a system that sent a 9-year-old to Tennessee for mental health services that he could have received here if we as a state were better prepared to support him. A child that needed a singular placement, and we didn't have a single one within the entire state that could be provided at the level of care that was needed. The child spent 90 days in youth detention, not because he committed any crime, but because this was a singular foster placement available for him, and as he waited to be sent out of the state. 11 years later, and this is still a reality, the Department of Justice investigation into the institutionalization of youth in Nevada ripped the lid off of what everyone already knew. Our kids need help, and the system as it stands is not ready. Nevada ranked 51st in the nation for children's mental health, and I'd like to see that turned around and for Nevada to be looked at as one of the models for children's mental health improvements. Let's prioritize our youth. Let's centralize services, and let's make this the easiest system to navigate. Let's improve access to care, and especially access in our rural and frontier areas. Let's bring our babies home. Focus on reinforcing the services we already have in state, and let's build a system that works exceptionally for our families. Youth with emotional and behavioral disabilities grow into adults with emotional and behavioral disabilities. The time to intervene is now. We are the battle born, and this is what the battle born do. We take care of what's ours, and these children are ours. This is the right level. Nevada is ready to support, and you are the right legislators. Now is the time to take a step to make this better, and I ask that you thoughtfully consider this bill. Thank you.
Good afternoon, Chair Brown and members of the committee. My name is Dr. Amanda Habush-Deloy, AMANDAHABOUSHDELOYE. I am the director of the Nevada Institute for Children's Research and Policy at UNLV. However, I am not speaking today on behalf of my role at UNLV. I am here as a member of the Clark County Children's Mental Health Consortium. I've been a member on this group for the past about 15 years, and I won't reiterate what everybody else has said, but we do know that we have a lack of services, coordinated services that fit the needs of our families. We definitely need to grow our service array in the community to make sure that families have options and choice that fits their needs. That includes options that are in the area they are, so transportation is not an issue, options in the language that they need to have services spoken, and at the times that are available for families, that are convenient and available for families. These are all things that we need to work on to bring to better support families. And one of the reasons why we need this office is because while there are groups and providers and passionate people out there who care to increase these services, we do need a coordinated effort in order to really make that happen. Again, on behalf of the consortia, and we work with the other two consortia, the state, the Washoe, and the rural consortia, and we are all doing that work on top of our regular jobs, and we need to make sure that there is a dedicated person and office who can help coordinate these efforts and make sure that there is follow through with recommendations. We have been putting together reports for years with many great recommendations, and we do our best to see those through, but we don't always have the resources to make that happen. And so this office would be a place to make sure that those resources and those actions can happen. Some of the things that we would like to ensure that we see in this office is that the office does work with, as I said, the regional consortia to work with the state plans that we do put together. We put together 10-year plans as well as annual reports on the progress of those plans, and we'd be great to have an effort to do that jointly with this office. We also want to make sure that this person has authority. That's the one thing that we've been lacking. We feel like in the field when there is either a disagreement or an agency isn't sure which agency is the right one to be providing services. If that child or family has dual diagnosis, then that child often ends up stuck without any services because nobody can make a decision on who's supposed to move forward. So we need to make sure that there's somebody with the authority authority that can make those decisions so that services are not withheld from our families. And one of the best ways to do this is also to set up MOUs with those agencies to make sure that in transitions, or if the office ever doesn't exist anymore, that we've got lasting policies and procedures that will make sure that our children and our families are taken care of.
Thank you so much for your
I also-
testimony. I appreciate that. If you have additional written comments, please go ahead and submit them to our secretary. Thank you. Is there anyone else in Las Vegas who would like to offer testimony in support of this measure? Not seeing any movement. We'll come back up here to Las Vegas. Are you here in support of this measure? Or to Carson City, sorry. I'm at home in my head. I apologize.
I was going to wait patiently. Yes, Carson City. My name is Rebecca McGough, MCG, OUGH. I am a licensed clinical social worker. I do specialize in working with children and families. I have the opportunity to work with them within the rural communities. I'm also a Rural Children's Mental Health Consortia Vice Chair. I've been a member of that committee for 9 years as the foster parent representative. I'm coming to you because, like the gentleman had said earlier today, I have 2 master's degrees. I had adopted my daughter out of foster care when she was 15, and the amount of trauma and needs she had for mental health were very extreme. And this is not unique to my daughter. I'm seeing it throughout the families that I serve within the rural communities. There is not a single point of contact to get a referral. We basically, and the rurals were really great at working together as much as we can once we make contact, but we kind of have to MacGyver services for these kids and their families. Because the reality of the situation is if we don't actually support the families too, an attempt to support the children is going to be moot. I think one of the more important things is this is the first time I've seen something in over 9 years that I've been in mental health in some capacity that actually offers some sort of services to families to figure out how to navigate these systems, whether it's writing a letter to the school district to get an IEP implemented, whether it's figuring out a way to get a referral. The other thing is this would be wonderful in the rurals because there is a severe lack of services, and additionally, there's a severe lack of transportation when services are identified. So if I have a child that needs to be in an IOP program, which is intensive outpatient, if they've been inpatient for suicidality, a lot of the families in the rural communities cannot manage that, and they are not appropriate for basic outpatient services, but there's nothing else available to them. So this office actually does provide a capacity to do something that the state hasn't seen yet and is desperately needed. Thank you.
Thank you. Seeing no one else here in support of this measure in Carson City or in Las Vegas, AVH, is there anyone on the telephone lines wishing to offer testimony in support?
If you would like to testify in support of Assembly Bill 339, please press star 9 now to take your place in the queue. Again, if you would like to testify in support of Assembly Bill 339, please press star 9 now. Chair, there are no callers choosing to testify in support at this time.
Thank you, AVH. At this time, we'll move into opposition testimony. If you are here in opposition of Assembly Bill 339, please come forward in Carson City or in Las Vegas. Seeing no movement at all. AVH, is there anyone on the telephone line in opposition of Assembly Bill 339?
If you would like to testify in opposition to Assembly Bill 339, please press star 9 now to take your place in the queue. Again, if you would like to testify in opposition to Assembly Bill 339, please press star 9 now. Chair, there are no callers wishing to testify in opposition at this time.
Thank you, AVH. At this time, we'll move into neutral testimony. Is there anyone here wishing to offer neutral testimony in Assembly Bill 339 in Carson City? Seeing none. Las Vegas? No movement. AVH, is there anyone on the telephone line wishing to offer neutral testimony for Assembly Bill 339?
If you would like to testify in neutral to Assembly Bill 339, please press star 9 now to take your place in the queue. Again, if you would like to testify in neutral to Assembly Bill 339, please press star 9 now. Chair, there are no callers wishing to testify in neutral at this time.
Thank you. We will welcome back the bill sponsor if you'd like to make closing comments.
Thank you, Chair. Thank you for Heather Goulding for the record. Thank you, Chair. Thank you, committee. As a mom, there's nothing quite as distressing as seeing your children suffer. So I urge you, when you're thinking about the young people in Nevada that need our support, I urge you to support this bill as one step forward in taking care of those people that need our love and compassion and some hard work ahead of them for them. Thank you.
Thank you. That will close our bill hearing for Assembly Bill 339. For those of you who are in attendance here in Carson City and in Las Vegas, we're going to stand in a brief recess. I understand we're having some technical difficulties, so they are going to reset our system. Our screen has been frozen in Las Vegas, and while they can hear us, they cannot see us. So we're going to go ahead and reboot the system, and then we will come back as soon as the system is up. Hi, and welcome back. As we reconvene the Committee on Health and Human Services, We will now open the hearing for the next item on our agenda, Assembly Bill 380, and we will welcome our member up to do her presentation. Please take your time, get settled, and you may begin when you're ready.
Good afternoon, Chair Brown May and Vice Chair Wen and fellow committee members. This is the last one that I'm presenting to HHS, so that's the last you'll have to hear from me for a little while. I'm Assemblywoman Rebecca Edgeworth. It's Rebecca, Edgeworth, Edgeworth, and it's my honor to represent Assembly District 35, which is in Southwest Vegas. Thank you so much for the opportunity to present this Assembly Bill 380. The bill makes changes to the requirements for mobile crisis teams to allow them to be more efficient and flexible when responding to members of the community who are in behavioral health crisis. So I'm going to do a brief introduction about how this came to me, and then I have my friends from Las Vegas Fire that are in Las Vegas that will talk to you about what the problem is, what the solution is, and a little bit about the bill. So just to provide a tiny bit of background, the 988 crisis team, hopefully you've heard of 988, it's been around for a while. Certainly it's been around for a while in the legislature. It's been worked on since 2021 in implementing it, but briefly it is a crisis lifeline or a suicide hotline. That's the way it's supposed to be operating, helping people who are in mental health distress get immediate access and a crisis counselor. It includes crisis response teams throughout Nevada, although not all parts of Nevada have it. These teams respond directly to these individuals who are in crisis. So as a physician, I'm engaged in a lot of outreach, like a significant amount of outreach, and I see people every day. I see firsthand how crucial mental health intervention is to these people, and sometimes they just need a little bit of help. They don't need the full court press, just a little bit of help to get them to the resources that they need. So the problem is that if you have a mental health crisis and you trigger the team by 911, so that's the one we all know, 911, when it goes into dispatch, each municipality is allowed to decide what the response is. The response, certainly if it was dangerous, of course, police would be involved. Certainly if it was medical, paramedics would be involved. But this allows, in the 911 system, it's allowed that crisis intervention teams can be deployed if they just need a little bit of help with mental health. So this includes Washoe County has the Mobile Outreach Safety Team, which we call MOST. City of Las Vegas has a crisis response team. Also, Las Vegas Metro has a crisis intervention team. So these exist and work very well in certain municipalities if we are triggered through the 911 system. We know that these are doing it this way is resulting in less hospitalizations and less people going to jail, and it's been very, very highly effective. The reason that this bill is urgently needed is because as it's currently written, if you trigger the response through 988, there's a very rigid and specific team that is required to come out. And it doesn't allow for a lot of flexibility for the state. Each municipality is different, and it should allow for some flexibility depending on what the individual needs are of the person. So we're trying to align the response essentially with what is available with 911. And also, the 988 Crisis Intervention Team, Medicaid is here. Thank you so much, Stacey Weeks, for being here to address it. But Medicaid will be able to help to reimburse some of these crisis intervention teams, which will again allow more municipalities to be able to do this kind of crisis intervention that's helpful for everyone. So now I have the Assistant Fire Chief, Arthur Perillo, way up there in Las Vegas, dressed very fancy, and Heather Thanapone, who works with Crisis Response Team, both from City of Las Vegas Fire. We have slides. Let's see if I can advance them while they talk about them. Please go ahead.
All right. Thank you, Assemblymember Edgeworth, and thank you, Chair Brown May and Assembly members. My name is Art Perillo. I'm the Assistant Fire Chief over Emergency Medical Services for Las Vegas Fire and Rescue. My name is spelled ARTPERILLO. Thank you for taking the time to consider and discuss Assembly Bill 380 today. I appreciate your attention and dedication to this piece of legislation. I'm going on to the next slide there, if you guys can see the slides in front of you there. What we're going to discuss over this presentation is the 988 system, the benefits of the changes, how the bill will benefit the state, our communities, organizations, the patient, and the healthcare system overall. Going on to the next slide. The intent of this legislation is to build out a comprehensive continuum for behavioral health crisis in the state of Nevada. 988 is addressed in NRS 433.702 and is the National Suicide Prevention Lifeline program that provides 24/7 support for those experiencing a behavioral health crisis in Nevada. The mobile crisis response portion of this system is covered in NRS 433.704, Section 2, and is the portion of the legislation we are asking to be amended to increase jurisdictional flexibility in implementing mobile crisis response teams. NRS 433.706 addresses crisis stabilization centers, which is a fixed location that provides short-term care and follow-up resources for patients experiencing behavioral health emergencies. Moving on to the next slide. Building on the foundation of deploying a mental health professional to assist patients experiencing a behavioral health crisis, the proposed language enables each Nevada community to expand the composition of their mental health team to meet the unique needs of their jurisdiction. The suggested language also aligns with the recent revised Chapter 403.6I Mental Health Services of the Medicaid Service Manual. Moving on to the next slide. I believe everybody's got a copy of the slides with them. That's why I'm not reading the slides to you. The state of Nevada will benefit from the amendment as it allows each state jurisdiction to develop a team that fits the needs of their community. It also provides the appropriate resources to the patient at the scene of the crisis, reducing unnecessary hospitalizations and the cost to insurance providers, including Medicaid. Our communities will benefit because responding the appropriate resource can improve public safety resources availability throughout the community. The mental health needs in the state of Nevada exceed the resource capacity. The suggested language aids in bridging the gap of service. Public safety organizations will benefit from providing the patient with the correct resource at the patient's point of entry into the healthcare system and reduce reliance on 911. The patient will benefit from receiving the appropriate resource from their point of entry into the healthcare system and connection to needed resources sooner than the traditional pathway. The healthcare system will benefit from having more hospital beds available for acute care. And that's the end of the slide presentation.
Thank you, Rebecca Edgeworth, for the record. I will keep it short to say I am the sponsor of this bill. I do feel strongly about medical and behavioral health. Of course I do. I think we all do. But I will say that I certainly didn't write this bill, and so many people were involved in this. Thank you for all the hard work to Las Vegas Fire and stakeholders and hospitals and municipalities and all of the people that work together. So I'm so excited to tell you I have no amendment for this bill. Unless you have not signed it and you would like to sign it, please let me know. And with that, I think we are ready for questions.
Thank you. Thank you for your presentation. We do have a number of questions. We'll start with Assemblymember Nadeem.
Thank you so much, Madam Chair. Thank you for the presentation. So my question is just to make it more clear. Is it for the Behavioral Health Emergency Team 988? Who is it going to be only covered with Medicaid insurance, or there will be more insurances that will be covering that?
Rebecca Edgeworth, for the record. I'll have Heather there. She's the one who implements the crisis response team down for Las Vegas Fire. Do you have any thoughts about the insurance situation?
Thank you for the question. Heather Tenpin, for the record, Heather, last name Thanepohn. I can get you exact answer on that. Currently, Medicaid does reimburse for the services, and we have had parity with some of the commercial products currently for our current crisis response services.
Thank you. Next is Assemblymember Ornlicker.
Thank you, Chair, and thank you for addressing an important issue. I'd like to go to the slide 4 where you compare the options now with what's in the bill. And I guess when one of you described the current structure as rigid, when I look at it, it looks quite flexible to me because you've got 3 options. You can do one of the 3. And the new language seems to track pretty closely and just do it in different ways, mixing and matching, like all 3 of the current options have somebody with behavioral health, and you require behavioral health. So I'm having trouble seeing how this changes things, that given the flexibility currently, it seems like they could make the same teams that they could make under the proposed bill. So could you?
Thank you. Thank you, Assemblyman Ornlicker, for the question. That's a good question. Rebecca Edgeworth, for the record. I didn't need the sign. So anyway, I know that this is a little bit confusing, but if I can just explain. Currently, what is required by 988 isn't flexible. It does include a person from police. It does include a paramedic. And then over on the other side, what we're proposing is that if they need police, certainly police would be there. If they need medical, medical would be there. But this allows more flexibility in who shows up. It could just be I see that I'm not answering your question very well. So I will also have Heather up in Las Vegas answer your question as well.
Ms. Sinpin.
Heather Chinpin, for the record, HeatherThanPohn. I will defer this question to Chief Perillo for his answer, please.
Thank you, Art Perillo, for the record. The difference is that the current language restricts us to requiring a peer support person on our team. One of the difficulties that we found in staffing our team is finding that peer support person. By removing the peer support person, we believe we can better serve our community, and it gives us the flexibility to not only serve those in Southern Nevada, but across the state. By taking out the requirement for that and ensuring that we have the foundation, as we discussed it here earlier, of the behavioral health professional on the scene, that foundation can be built on either with a peer support person, with law enforcement, or with a medical provider, depending on the jurisdiction and whatever they feel is best to meet the needs of their community. Did that answer your question, sir?
Yes, thank you. So that seems, because you're right, all 2A, B, and C include peer recovery. So you just want to not require peer recovery and let all the other be part of it.
Chief, I'm wondering if you have a response. Is there clarification, or I can move on if you would prefer not to at this point.
No, he interpreted what I was saying correctly, so I have nothing further to say on that matter. Thank you.
Thank you, Chief, for that clarification. I would also like to thank you for not reading the slides during your presentation. It is much appreciated. Thank you. Next question we do have from Assemblymember Jackson.
Thank you, Chair, and I'm very excited to be one of the sponsors on this bill. I do have 2 questions if we have time. My first question, will the reimbursed Medicaid services be limited to only crisis intervention, or will it encompass other services?
Rebecca Edgeworth, for the record. I guess we have Medicaid here but I don't believe that it has any impact on any other services. I think that the Medicaid that is covered will be the same. If I was wrong, somebody would have said something.
I guess that kind of answers my second question, but I'll ask anyway. Will these reimbursements interfere with any other prior authorized services with any other mental health providers?
Thank you for the question. Rebecca Edgeworth for the record. I don't think prior authorizations enter into this immediate care that's being given to people in need.
Thank you. Members, any other questions? Nope, seeing none. Thank you. I will ask you to step back from the table, and we will now open up testimony in support for Assembly Bill 380. If you are here in support of this measure, please come forward. I will just remind you, 2 minutes. Please state and spell your name for the record. We have lots of folks, so we're really going to hold you to your 2 minutes, if that's all right. Thank you. Go ahead. You may begin.
Good afternoon, Chair Brown May, Vice Chair Wynn. My name is Kayla Maese, spelled Kaylah. Last name is Maese. I'm a civil rights analyst at the ACLU of Nevada, and to keep it brief, the ACLU does support Assembly Bill 380, and we thank Assemblymember Edgeworth for bringing it forward. Thank you.
Good afternoon, Chair Brown May and members of the committee. For the record, my name is Taylor Avery, and I'm the Manager of Political Affairs for the Vegas Chamber. The Chamber is in support of AB 380. The bill will streamline the creation and operations of mobile crisis teams, which means those experiencing a behavioral health crisis will be able to more easily access support. The Chamber supports efforts to expand Nevadans' access to health care, especially in places where those needs are most critical. This bill will put another tool in the toolbox to help address the mental health crisis our state is facing. We'd like to thank the bill sponsor, and thank you to the committee for your time.
Blaine Osborne, Nevada Rural Hospital Partners, ditto.
My name is Robin Reedy. I'm the Executive Director of NAMI Nevada. That's the National Alliance on Mental Illness in Nevada. And we are absolutely supportive of using peer recovery support specialists in these settings. And in fact, we work very hard to train peer recovery support specialists, and we also have them become community health workers so that they can be very well-rounded. But we recognize that there's very little inventory of peer recovery support specialists out there, which is really the cause for making these changes here. So NAMI, Nevada, and the affiliates are in support of this bill.
Good afternoon, Chair, committee members. My name is Adrian Hunt, ADRIANHUNT. I represent Las Vegas Metropolitan Police Department. We strongly support this bill and would like to extend the gratitude to Assembly Member Edgeworth and the co-sponsors for bringing it forward. Our only concern lies in the potential limitation of responding with the mobile crisis team when resources are stretched thin due to other priority calls, as we have previously discussed with the bill sponsor. Once again, thank you for championing such an impactful bill. Thank you.
Madam Chair, members of the committee, I'm Mark Fiorentino from Chem for Kroll. It's Fiorentino. We represent the city of Sparks. With the exception of the last sentence, ditto. Can't agree with the last sentence because I didn't fully understand it.
Spencer Flanders for the record with Tri Strategies representing the Nevada Psychological Association. We're in support of this bill. Ditto.
Hello, Chair and Committee. My name is Amy Hines Sutherland. I'm the Health and Human Services Manager for NACO. Our members support AB 380, which allows for a flexible definition of mobile crisis teams. It reflects the reality of our state's workforce, our local needs, and our local expertise. Thank you.
Good afternoon, Chair Brown May, members of the committee. For the record, my name is Cadence Matijevich, CADENCE, representing Washoe County. Washoe County is proud to be here in support of the bill. We thank the Assembly member for bringing it forward. We have been actively engaged in building a community coalition to provide behavioral health response resources in our county. And if I may, Madam Chair, you asked under a question under the prior bill about what are we doing for children's mental health. And this committee may know that in July of 2024, Washoe County took over children's behavioral mobile crisis from the state. And so there are lots of resources being brought to bear. This bill will help that. Thank you.
Good afternoon, Chair and members of the committee. Areli Alarcon, spelled Areli Alarcon, with Query Nevada on behalf of the Hospital Corporation of America, here in support of AB 380. Thank you.
Good afternoon, Chair and Committee. It's Reagan Hart, ReaganHart, with the Nevada Hospital Association. We are here in support, and we have a special thanks for the sponsors and everyone working on this bill, and we ditto.
Thank you, Chair and members of the committee. Nick Ciccone, representing the City of Reno, ditto.
Reagan Comis, representing Anthem as well as UMC, we're in support.
Chris Bossi, BOSSE, with Renown Health, and we're in support. Thank you.
Allison Herzik, Director of Nevada Government Relations for Dignity Health St. Rose Dominican, we're in support. Thank you.
Lindsay Knox, KNOX, with McDonald Crano, here representing Rumza Health, in support, and ditto.
Isaac Tenorio, IZACK, TENORIO, with Strategy 60, today representing Nevada Health Systems, Chair Brown May, members of the committee. The Nevada Health System supports AB 380 as another tool in the state's toolbox to attempting to deal with individuals dealing with behavioral health crisis. Too often, hospital emergency rooms is the only place that any individual can get help during a behavioral health crisis, where a mobile crisis team is designed to provide immediate support and crisis interventions where incidents may be taking place. By helping de-escalating the crisis situations and assisting them with the seek treatment that they desperately need. Additionally, one wholeheartedly Me Too, our clients AMR and Medic West. Thank you so much.
Good afternoon, Chair and members of the committee. Mary Sarah Kinner with the Washoe County Sheriff's Office. We are pleased to support this bill and thank the Assembly member for bringing it forward.
Good afternoon, Chair Brown May, members of the committee, Joanna Jacob, on behalf of Clark County. I would like to say we're in support and ditto, especially to the comments of NACO. Thank you very much.
Ryan Beeman, representing the professional firefighters of Nevada. Just wanted to say thank you to the Assemblywoman for a great piece of legislation, and we support it.
Taylor Ellison, for the record, ALLISON, and ditto. On behalf of Lyon County, I guess I should say, ditto the sentiments on NACO, and this bill allows us the flexibility to implement the mobile outreach safety team in Lyon County. And Lyon County, I'll just note, recently received federal appropriation for a youth mobile crisis safety team.
Hi, Chair Committee, Zach Bucher, ZACHBUCHER, great city of North Las Vegas. I'd like to go off script just a little. No, I wouldn't. I would just like to say I will follow your advice, Chair, and certain members on your committee, and just say ditto as well. Thank you.
Thank you. Seeing no other support up here in Carson City, we'll go down to Las Vegas. You may begin.
Good afternoon, Brian Knudsen, representing the City of Las Vegas. I want to thank Assemblywoman Edgeworth for bringing this forward and for the committee's support. This is an evolutionary next step in our mental health care system. Thank you very much.
Good afternoon, Chair and Committee. My name is Lisa Kelso, LISAKELSO. I'm with the City of Henderson. I'm a licensed mental health clinician. The City of Henderson launched a mobile crisis intervention team in 2022. We are staffed by licensed mental health clinicians. We take referrals from police, fire, and medical providers for those experiencing behavioral health crises. We support AB 380 and the intent to prioritize a crisis response with licensed behavioral health and medical professionals. We're working with the 988 rollout process to continue to align our team to be eligible for Medicaid reimbursement and to coordinate on the development of a regional crisis response system. We've implemented evidence-based practice to respond appropriately to behavioral health crises and deflect patients from both criminal justice and emergency rooms. Best practice for response to people in crisis is a medical response, and although our team contracts with peer recovery support specialists, we agree they can be a follow-up referral and are not required in the initial response to someone in crisis. We think AB 380 allows flexibility for cities to structure their crisis intervention teams according to their needs, and we look forward to being a part of the state and the region's efforts to serve people with behavioral health needs appropriately.
Good afternoon. My name is Christina Burnett, KRISTINA BERNAT. I serve as the program manager for the North Las Vegas Fire Department Crisis Response Team. I am a licensed clinical social worker. We have licensed clinical social workers and licensed clinical professional counselors that are part of our team. We wholeheartedly support AB 380. It's a key initiative aimed at enhancing our mental health crisis response systems, allows us to continue doing the work we do without so many limitations. And I really just think this is a critical step toward ensuring that mobile crisis response teams such as ours continue to deliver immediate, specialized care to individuals in our community. Thank you.
Thank you. Is there anyone else in Las Vegas wishing to offer testimony in support? Seeing no movement. AVH, is there anyone on the telephone line wishing to offer testimony in support of Assembly Bill 380?
If you would like to testify in support of Assembly Bill 380, please press star 9 now to take your place in the queue. Again, if you would like to testify in support of Assembly Bill 380, please press star 9 now.
Good afternoon, committee. This is Matthew Cox, MATTCOX. I'm representing the Las Vegas Hills and the Mental Health Coalition. We are in support of AB 380, and we appreciate everything.
Hello, Chair Brown, Chair and members of the committee. My name is Rocio Budney, and I'm calling on behalf of the American Foundation for Suicide Prevention. And AFSP recognizes that connecting individuals with mobile crisis care resources as quickly and safely as possible can help to reduce the risk of suicide. Suicide is currently the 9th leading cause of death in Nevada and the 2nd leading cause of death for ages 10 to 24. Supporting AB 38 will ensure that everyone will have supportive services available to them, to those in crisis throughout the state. Thank you.
Caller with the last 3 digits, 000, please press star 6 to unmute your phone. You may begin.
Greetings, this is Jerome Alexander, JeromeAlexander, a board member with the Nevada chapter of the American Foundation for Suicide Prevention. Chair Brown, May, and members of the committee. The American Foundation for Suicide Prevention is a voluntary health organization that provides those affected by suicide with a nationwide community empowered by research, education, and advocacy to take action against this leading cause of death. The Nevada chapter supports AB 380 because it is taking necessary steps to address the behavioral health crisis in our state. We thank Assemblywoman Edgeworth for her legislative work aimed at creating efficient mobile crisis teams that respond to emergencies and help individuals access proper treatment. We urge you to support for AB 380.
Chair, there are no other callers to testify in support at this time.
Thank you, AVH. At this time, we'll move into opposition. Is there anyone here who would like to offer testimony in opposition of Assembly Bill 380? Please come forward at this time. Seeing no movement here in Carson City and none in Las Vegas. AVH, is there anyone on the telephone line who would like to offer testimony in opposition of Assembly Bill 380?
The public line is open and working. There are no other callers to testify in opposition at this time.
Thank you, AVH. At this time, we'll move into neutral testimony. Is there anyone here who would like to offer testimony in neutral on Assembly Bill 380?
Cody Finney, Administrator of the Division of Public and Behavioral Health. I will be very brief. We are neutral. We are currently preparing the regs that are required in this legislation, and we'll continue to do that in preparation for moving forward. But we're and we will continue to work towards ensuring that peers are available, that professionals are available, and getting the right people to the right crises as best we can. And I'd just like to express my gratitude for the passion that clearly exists for making sure that we can do this.
Thank you, Administrator, for being here. We appreciate you. Go ahead in Las Vegas.
Hi, good afternoon. Ellen Richardson Adams for the record. ELLENRICHARDSON-ADAMS. Thank you for this opportunity. Along the lines of Administrator Finney, also neutral on behalf of Division of Public and Behavioral Health. From a service provider perspective within the rural counties and within the Clark County area, this provides opportunity for flexibility and the ability to serve those given the resources within our varying communities. So thank you for this opportunity.
Thank you, Ms. Richardson Adams. Same to you. We appreciate that you are being here and putting your comments on the record. ABH, is there anyone on the telephone line wishing to offer testimony in neutral on Assembly Bill 380?
Public line is open and working. There are no other callers to testify in neutral at this time.
Thank you. At this time, we will invite our bill sponsor back up for any closing comments.
Thank you, Chair. Rebecca Edgeworth for the record. Thank you so much to the Chair. Thank you to the committee. I urge you to consider this really important legislation. This was really easy. 1 million people were in support of me doing this, and I thank everybody for all their hard work. And if anybody hasn't signed on and would like to sign on, please let me know. Thank you.
Thank you. With that, we will close the bill hearing on Assembly Bill 380. That moves us to our final order of business for the day, which is public comment. If you would like to provide public comment or testimony, you're welcome to come in person. You'll have 2 minutes, or you can dial 888-475-4499. And then when prompted, provide the meeting ID 886-996-51578, and then hit the pound sign. Seeing no one here in Carson City wishing to offer public comment, no one in Las Vegas coming forward. ABH, is there anyone on the telephone line that would like to offer public comment today?
If you would like to provide public comment, please press star 9 now to take your place in the queue. Again, if you would like to provide public comment, please press star 9 now. Chair, there are no callers choosing to provide public comment at this time.
Thank you, ABH. Members, that concludes our business for today. We will meet again on Wednesday of this week. Until then, have a great afternoon. This meeting is adjourned.